look at the research. So, Kirsty Gallacher, welcome to the show. Great to have you on board. Dr. Luke Charles, welcome to the show. Great to have you on board. Can we sort of begin with sort of what the research suggests around these sort of biomarkers that are significant in giving us an indication of where our health is? And maybe if you start with your story, Kirsty, be interested to see what your take is on it.
Well, yeah, I mean, hi there. I don't think a lot of us know enough about our health. I think is the sadly the key thing. There are sort of 5 things everyone should know about their health, and shockingly, most people don't know what their blood pressure is, what their cholesterol levels are like, what their weight is, are they at risk of diabetes, have they got diabetes? And so I think that basically it's having an assessment to see where you're at and look at those key indicators. And it's not just for now, Jimmy, it's for later on. It's how are we going to be in a couple of years' time? Where are we at? What's our lifestyle like? So basically, I'm working with Bupa Health Clinics who are helping people understand these key health indicators. And I think too many people ignore where their health and where they're at and those little things that might not quite feel right. And obviously I mean I think as we get older, and I was 50 last week, we do worry more about our health, don't we? We just do. We all are a bit more on it, or should be. But a few years ago I completely separate from this topic in a way, but it's to do with health. I obviously had a huge health scare which has made me really wake up, and that was I sort of went deaf in my right ear and went to the doctor, and it was obviously an emergency. Could have been a brain tumor. It is a brain tumor, but it is a benign acoustic neuroma that I have, and I had radiotherapy for it last year. Now, had I not gone to the doctor early, it could have been something else. It could have been a malignant brain tumor, or it could have, whatever. It could have been something completely different. And I think it's just warning signs and us being aware of where we're at and making the changes to our lifestyles. Would you agree with that, Luke?
Absolutely. So, and Kirsty, you're absolutely right. I think knowing our numbers can be really helpful. Certainly, when we're going north of 40, knowing what our blood pressure is, our sort of cholesterol levels, our diabetes, sugar levels. The reason being is that a lot of these conditions like heart disease, early heart disease, blood pressure, type 2 diabetes, they can often be silent. So they quite often don't exhibit any symptoms until real damage has been done. And so opportunistically trying to identify these conditions can be really, really helpful. And as we know, the earlier you pick things up, often the easier it is to treat. And we know prevention is often better than cure. So sometimes our numbers can indicate that we haven't got these conditions yet, but we're headed towards them. And Kirsty, as you say, sometimes when we have symptoms, there's something strange going on in the body. We're not, we haven't had this before. We know it's not our usual indigestion or whatever. That it's really good to sound these out with a healthcare professional. So I say to people I see that if you've got something going on in the body, you're not sure what it is, it's lasting for more than 2 to 3 weeks, please get it checked out with a healthcare professional. Obviously sooner than 2 weeks if it's something dramatic like chest pain or difficulty breathing. Obviously, we want to balance, being on top of your numbers and seeing healthcare professionals with, not trying to make people unnecessarily health anxious. So there is a balance to be struck, but generally kind of trying to get pursuing some form of health check checking some of those key numbers every 1 to 2 years when we're north of 40, and having that 2 to 3 week rule when something's strange going on in the body, that can help keep us safe and well.
Yeah, that's an interesting one, Doctor. Sort of like a 2 to 3 week rule, and sort of having a check. And I'm certainly no medical expert, but I sort of try and keep on top of things in terms of training, meditation, and eating as well as one can, and going for a checkup for various sort of biomarkers as and when possible. Are there any sort of obviously sort of like you mentioned there, symptoms, there's an overlap with, I'm sure, many conditions, but I suppose, is there any sort of like biomarkers that you think, Doctor, that I know it could be. We could go through a lot of. What are the main ones you think in terms of sort of at least being aware of? I must admit, I sort of try and keep track of cholesterol and blood sugar and other stuff. To be fair, but I mean everyone's different. But what's your take on it in terms of what are sort of the a reasonable check if there's no sort of any sort of symptoms type thing? Generally, you feel pretty well. What are some of the biomarkers that are worth sort of considering to be checked out for?
So that's a really great question, Jim. And yeah, the really key ones are blood pressure, cholesterol and lipids. So that can include triglycerides, but essentially they're kind of cholesterol checks. There's one we call HbA1c. That's screens for diabetes or help diagnose diabetes. It looks at how sugarized the blood's been over the last 2 to 3 months. So that's a useful one to have as well. Knowing our weight for our height. So we know there's something we refer to as body mass index. It has its limitations, but essentially your weight for your height. But there are other things that can help complement it to give you a really accurate picture of your sort of how much additional weight you might be carrying. And so that's things like body fat and waist to height ratio. And then there's a couple of tools that we use a lot in the medical world. So there's one that helps to kind of predict your future risk of heart disease, and another that helps to predict your future risk of diabetes. So those are kind of the key tools. I know there's lots of tests out there. Some tests, if ordered in a less judicious way, if undertaken in a less judicious way, can sometimes lead people down garden paths. If they have a positive result and no relevant symptoms or risk factors, sometimes that can create a confusing picture for them. So it is useful, to just be aware of that. Sometimes not, more testing the merrier. Sometimes that's not the case. As I say, the key things are blood pressure, your weight parameters, sugar levels, cholesterol, and then we use that with some other kind of wider information about you to kind of predict your heart risk and your 10-year risk of developing type 2 diabetes. So those can be really helpful. They give a picture of your cardiometabolic health, which links with lots of different kind of medical conditions.
Yeah, absolutely. So some of them certainly resonate with myself in terms of not keeping on track of things and that sort of stuff. But I mean, there's a lot of information, I suppose, to take on board. But if people want to learn more about, where can they go to find out more information? If they're sort of listening and thinking, what, I want to sort of learn more about health awareness type thing. Is there anywhere they can go to? Because there's a lot of information out there. I'm sure you're familiar. There's loads of information out there on social media these days, and some of it probably isn't accurate and misinformation. But where can they go to get some decent information to just learn a little bit more and maybe look into sort of checking themselves out?
I mean, you're absolutely right. You have to be a little bit careful about, because there is a lot of health information out there, and some is evidence-based and some might be less evidence-based. Of course, I work for Bupa, so I support the Bupa sort of media team, and we really make sure that our health content on Bupa.com and the My Bupa app is really evidence-based, useful information. There are, of course, other resources, and we can share those with you afterwards. But the NHS Choice website has good information on it. Patient.info has good information on it. But there's obviously they're good places. Bupa.com and those other sites I mentioned are good places to start.
Yeah, no, absolutely. And just sort of out of interest, sort of, Kirsty, with yourself, I mean, you mentioned about the sort of the hearing thing. Did you have, if you don't mind me asking, was there anything else that sort of like symptoms wise? It's one of them really where you kind of think, well, these things would be going on in the body without sort of realizing it.
Do you mean just purely about the tumour?
Yeah.
Yeah, no, nothing at all, actually. No, literally just my hearing went completely because obviously the tumour was growing and has been growing quite quickly. So then my hearing was, depleted in some way. I have tinnitus now, unfortunately, which is something I have to live with. That is purely because of the tumour, and it's on the. I mean, Luke will know more about this. To do with the nerve, and it's obscuring the inner ear canal. But yeah, no, it literally was my hearing, and I just thought, this isn't right. I've got to do something about this. And I was very nervous about going to my GP and my doctor, but I thought, I've got to do this. And I didn't actually tell anyone about it. I think I just did it. It was just like a reflex action of kind of I know this could be bad news, so I need to go and sort this out. I think you just read about it, don't you? And anything to do with hearing or sight or anything like that, I think you've got to go and do the right thing. So I'm really glad I did. I could have lived with it and not done anything, although my hearing is so bad, it would have been hard. And then, it could have been actually completely inoperable, which they would rather not operate on this tumor. But hopefully the radiotherapy's worked and it will have shrunk it or done something brilliant to killed the DNA. So we hope for that. But unfortunately, I have to live with the hearing loss and tinnitus. But listen, that's a small price to pay for keeping it at bay, really. And I'm very lucky that it is manageable, really. Yeah, but that's it. Yeah.
It's just sort of like, it's one of them. It's like, I suppose it's a good job you got that sort of self-awareness. I think sometimes it's easy sort of like,
Yeah.
if you've got symptoms and sort of pass them off for like, the usual thing. Is it stress? Is it one thing or the other type thing? But yeah, that sort of shows the importance of, because I know now they've got like, also we talked about biomarkers, but I'm familiar with other tests now, like the hearing and vision ones too. And even if there isn't anything sort of like notably wrong, sometimes it's maybe worth getting that sort of checked out. I know I certainly do, just to keep on top of things. So, but no, it's been great sort of speaking to you both. It's been really interesting. I'll
Thank you, Jimmy.
check it out and learn more. Thanks for your time and have a great week.
Thank you very much.
So, Kirsty Gallacher,